It is time now to get your biggest COVID questions answered with Dr. Ruth Berggren, infectious disease specialist with the Long School of Medicine at UT Health San Antonio. Doctor, thanks as always for being here. Good to see you. Let's start with a question that I keep hearing more and more discussion about: the risk of a fully vaccinated person being around someone who is unvaccinated. Is there an increased risk if you spend time with somebody who has not been vaccinated?
So there is risk, because this has now been shown that vaccinated people can get infected, usually very mild and maybe even asymptomatic. And you're most likely, if you're a vaccinated person, that's most likely to happen if you're around an unvaccinated person. It's also true that vaccinated people can spread virus, but we know that they shed it for a much shorter period of time. So if you want to prevent getting COVID, you're better off hanging out with vaccinated people rather than unvaccinated people.
You talked about this, I know, in a story we did last week, but we get these questions too. What should you do if you're sick with COVID, but you're not hospitalized? What's the best, line of thinking there? So
first off, if you have any of the risk factors that make for a poor outcome, such as being overweight, such as being older, such as having diabetes, high blood pressure, heart disease, lung disease, kidney disease, if you're one of those people, which is a lot of us, then you should reach out to a doctor and you can get referred for monoclonal antibody infusions, which are more and more data are accruing. These monoclonal antibody infusions are really helping people stay out of the hospital. That is the first and most important thing. So don't just hang out waiting to see what's going to happen. If you have the diagnosis, you have symptoms, and you have any risk factor for doing poorly, reach out right away to get yourself in the queue to go and get monoclonal antibody infusions. There are other things you can do that are a lot of common sense things. You can not smoke. And by the way, think about quitting smoking now and getting healthy during the COVID pandemic. You can stay home and be well hydrated, monitor your oxygen level with a home pulse oximeter. And what we look for is if the pulse oximeter shows a reading below 94%, if it's dropping, that would be a reason to go to the emergency room. If that's not happening, though, and you're home, you can stay well hydrated, get a lot of rest, abstain from smoking. And yes, there are vitamins and supplements that may be helpful, but those have not been shown to be life-saving. So you can take vitamin D, you can take zinc lozenges according to the label, you can take 3 to 5 milligrams of melatonin, the natural sleep hormone, at night. That will help you get a good night's sleep. It may or may not have some anti-inflammatory effects. But the first and most important thing is let somebody know about it, as in a doctor or a nurse, so you can get referred for monoclonal antibodies.
We were just showing images of that story that you did with us a few weeks ago. It's on our website right now if people want more information on all the things that you just talked about. I want to talk about schools. We aired earlier in this newscast, Floresville ISD, for example, one of the schools in our area shutting down for a period of time because of an outbreak, doing things like deep cleaning, taking some time to hopefully, curb the spread. Are those kinds of things efficient? I mean, is that enough to essentially clear a school of a COVID outbreak?
So unfortunately, the main way we spread COVID is one person to another through the respiratory droplets, right? So I never would be upset with anyone for cleaning. It's always a good thing to clean, but you're not going to rid the school of their COVID problem by doing the deep cleaning, because what needs to happen when people come back to the nice clean school is they need to have their masks on. And as many people as are eligible for vaccination, anybody 12 and up, should be vaccinated. That's how to really get control over it, is masking, social distancing, and vaccination, not deep cleaning.
I want to give you a question that Marie asked me on my Facebook page. Can you ask the experts how children are being affected by long-haul COVID and what percentage of cases are going on to long-haul COVID? I've read in some age groups, 50% of COVID cases are having long-haul symptoms more than 2 weeks after acute disease is over with. any changes to long haul warnings when it comes to the Delta variant? So a lot of different questions in there, but a lot about the long haul COVID symptoms.
Well, let me just start by saying we're still collecting the data on that, and so you can expect these numbers to change as we gather more and they get firmed up. But estimates have ranged up to as high as a quarter of kids will have one or more symptoms that last for a long time. Now, there's a more recent study that's in preprint right now, has not gone through peer review, but it did find that 14% of teenagers between the ages of 11 to 17 who tested positive had 3 or more persistent symptoms 15 weeks later. And they compared them to a group that tested negative, and those guys had some symptoms too, but only 7% of them had symptoms. So it is a concern, and people should be aware that just because COVID tends to be milder in children, that it doesn't mean that they don't have the risk of dealing with long-haul COVID symptoms, even after a mild infection.
Dr. Berggren, there was a clinical trial getting underway where you are looking for people infected with COVID-19. Explain the criteria of the kind of patient that could take part in this, and what's the purpose of this trial?
So we're talking about the Active 6 trial, which has been approved to be activated here at UT Health at the Long School of Medicine. And it is an NIH-sponsored study, which is very well designed. They're going to get 15,000 people enrolled at not just our site, of course, but at multiple sites. And it is comparing fluvoxamine, which is an already FDA-approved drug for depression and obsessive compulsive disorder. So it's a well-known drug with a good safety profile. They're comparing fluvoxamine to a steroid inhaler called fluticasone, and also to ivermectin. And all of these would be compared to placebo. So if you enroll in it, you get randomized to an arm, and you can decline an arm. If you were randomized to, say, ivermectin, you could say, well, I don't want to be in that. And potentially you could get randomized to another one, but they're all placebo controlled. So in other words, whichever arm you're in, you're either getting the real drug or you're getting a placebo. Now, this trial is for people who have been diagnosed, confirmed with COVID-19 with an approved test, who have been sick for less than 10 days, and who are over 30 years old, 30 years or older. So you'll need a referral, and you will not have to come to the hospital to get enrolled, and the drug would be sent to your home.
All right, so information on how to take part in that study, go to UT Health's website?
Yes, that will be on the website.
And you'll need a referral from your doctor. Dr. Ruth Berggren, thank you for your time as always.
Most welcome.